What if the position you've slept in your whole life has been silently straining your heart every single night? Before you close your eyes tonight, there's something crucial you need to know. It requires no money, no prescription, and no special equipment, just a simple change. This one adjustment could lower your risk of stroke and life threatening blood clots while you sleep, starting tonight. Yet, most adults over 60 have never even heard about it. Silent circulation damage doesn't announce itself. It builds night after night when your body remains in the wrong position. Blood flows more sluggishly through your deep veins. Pressure builds in vessels already working harder than they did decades ago, and the conditions for dangerous clots quietly worsen. It's not dramatic. It's not painful. It's gradual, and that's what makes it so dangerous. I'm Dr. Lina Laurent. For over 2 decades, I've worked at the intersection of cardiovascular medicine and sleep, studying what happens to your heart, veins, and brain during the hours most doctors never ask about. What I'm about to share with you is something I wish I'd told every patient I've ever seen, long before they needed me. There's one sleep position that actively helps prevent blood clots in your veins while you sleep. One position that measurably reduces strain on your heart for all 8 of those hours. And almost no one is using it. Not because it's complicated or requires anything you don't already have, but because the person who knows the research, the cardiologist, the vascular specialist, the physician who sees you for 15 minutes once a year, has never brought it up. That conversation starts now. The answer itself is simple enough to say in one sentence, but a sentence without the science behind it is just advice. And advice alone doesn't change behavior, understanding does. So stay with me because by the end of this video, you won't just know what to do, you'll know exactly why it works. And that knowledge is what will make you actually do it tonight. Before I reveal the position, you need to understand something almost no one in medicine takes the time to explain. Sleep is not passive. Not for your heart, not for your blood, not for your brain. While you lie there with your eyes closed, your cardiovascular system is doing some of its most critical work of the day. Your blood pressure is trying to drop into recovery mode. Your lymphatic system is clearing toxic proteins from your brain. Your venous circulation is returning blood from your legs, abdomen, and pelvis back to your heart through a network of vessels that, after 60, are working harder than they used to. Here's what changes everything. The direction your body faces during those 8 hours determines whether that work happens efficiently or under strain. For most of medical history, sleep position was treated as a comfort issue, not a cardiac or circulatory one. Doctors asked about diet, exercise, medications, and stress levels. No one asked which way you faced when you slept. That's changing. Over the last 2 decades, research has made one thing clear. Your sleep position is a cardiovascular factor, one your body experiences for a third of your life. And after 60, when the margins are smaller and the stakes are higher, it matters more than most people realize. Let me introduce you to a patient I'll call Margaret. Margaret was 71, a retired nurse, and more medically informed than most of my patients. She ate carefully, walked daily, took her blood pressure medication without fail, and had regular cardiac checkups. She came to me not because of a crisis, but because of a pattern she couldn't explain. Her morning blood pressure readings were consistently higher than her evening readings. Her cardiologist had adjusted her medication twice, but nothing changed meaningfully. She also mentioned, almost as an afterthought, that she'd been waking up with her right arm numb for the past 2 years. She assumed it was a circulation issue from how she positioned her arm. She'd never connected it to her heart. When I asked her what position she slept in, she said immediately, "On my right side. Always have." We'll come back to Margaret because what happened in the 6 months after that conversation is why I make videos like this. Here's the position, the one that works for your heart, veins, and brain simultaneously. Sleep on your left side. Now, let me show you exactly why. Without the science, it might sound too simple to be real. With it, you'll never sleep on your right side the same way again. Reason 1, your heart isn't centered. This surprises almost every patient I explain it to. Your heart isn't in the middle of your chest, it's offset, positioned significantly to the left. Roughly 2/3 of your heart's mass sits on the left side of your body. That's just anatomy. Now, consider what happens when you sleep on your left side. Gravity works with your heart. The natural angle of your heart's position is supported, not resisted. Your heart doesn't have to work as hard to push blood into circulation. Think of it like carrying the same weight downhill instead of uphill. Same load, same distance, but dramatically less effort. Your heart beats about 100,000 times every day. Over a lifetime, that's a number too large to comprehend. But what it means is this: anything that reduces the workload of each beat, even slightly, adds up to something profound over years and decades. After 60, when the heart muscle may already be stiffer or less efficient, every bit of mechanical advantage counts. Left side sleeping gives your heart that advantage every night for 8 hours for free. Reason 2, the inferior vena cava. This is the piece of anatomy your cardiologist has almost certainly never discussed with you, and it might be the most important structure in this conversation. The inferior vena cava is the largest vein in your body. Its sole job is to carry deoxygenated blood from your lower body, your legs, abdomen, and pelvis, back up to the right side of your heart where it can be pumped to your lungs for reoxygenation. Here's the critical detail: this vein runs along the right side of your spine. When you sleep on your right side, the weight of your organs, your liver, the heaviest organ in your abdomen, along with your stomach and intestines, presses down on that vein. Not a complete blockage, but a gentle, sustained pressure that slows the flow of blood returning to your heart throughout the night. And slower return means your heart has to work harder to compensate for the reduced blood volume, night after night, year after year. For a heart already working against stiffer vessels and reduced elasticity, the cumulative effect isn't trivial. When you sleep on your left side, that compression is entirely removed. The inferior vena cava flows freely. Blood returns to the heart without restriction. Venous return, the efficiency with which blood flows back to the heart, improves measurably. And for adults over 60 whose veins have lost some elasticity and whose venous valves aren't as effective as they were at 40, removing that obstacle makes a real difference. Reason 3, blood clots form in still blood. Thrombosis, the formation of clots inside your veins, is one of the most dangerous and silent cardiovascular threats. Deep vein thrombosis, DVT, clots forming in the deep veins of your legs and pelvis, can kill by traveling to your lungs as a pulmonary embolism or by contributing to a stroke when clot material enters your arteries. Here's what most people don't know: blood clots don't only form on long flights or after surgery, they form wherever blood moves too slowly. The medical term for sluggish blood flow is venous stasis, and it happens every night in people who sleep in positions that compress their circulation. When you sleep on your back or right side, blood can pool in the deep veins of your legs and pelvis over those 7 or 8 hours. After 60, circulation naturally slows. Vein walls lose elasticity. Blood viscosity changes, especially in people on certain medications or even mildly dehydrated. The conditions for clot formation are present every night. The question is whether your sleep position is making that risk better or worse. Left side sleeping actively encourages venous circulation through your deep veins. The inferior vena cava flows without compression. Blood keeps moving, and moving blood is safe. Stagnant blood is where the danger begins. Here's a question I ask every patient I see after a DVT event: what position do you sleep in? The answer, almost without exception, is right side or back. That pattern doesn't surprise me anymore, but it should have been caught earlier. It should have been part of the conversation. That's the gap this video is trying to close. If you've made it this far, you're clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this video truly resonates with you, tap subscribe. It takes a second. If not, you might forget this channel exists and miss out on more life-changing information ahead. Before we go further, let me ask you, what position have you been sleeping in for most of your adult life? Left side, right side, back, or stomach? Write it in the comments now. I read everyone. And I want to know, has any doctor ever asked you that during a cardiac checkup? Reason 4, the glymphatic system and stroke prevention. This one surprised even me when I first saw the research. And I've been reading cardiovascular literature for over 20 years. Your brain has its own waste removal system, and it operates almost exclusively during sleep. It's called the glymphatic system. named for the glial cells that form channels through which cerebrospinal fluid flows, washing metabolic waste out of your brain tissue. Among the substances this system clears is amyloid beta, a protein strongly linked to Alzheimer's disease and vascular dementia. Another is TIU protein. These are the same materials researchers consistently find in the brains of patients with significant cognitive decline and cerebrovascular disease. Here's what the research shows. The glymphatic system works most efficiently when you sleep on your side. And between the two sides, left side sleeping appears to optimize the drainage pathways even further, based on the brain's internal anatomy. Why does this matter for your heart and stroke risk? Because vascular inflammation in the brain, driven in part by the buildup of these waste proteins, directly increases the risk of small vessel disease, microstrokes, and eventually major strokes. Your brain and cardiovascular system aren't separate entities. They share the same blood supply. What harms one harms the other. Protecting your brain's overnight cleaning system is protecting your cardiovascular health at the same time. Reason 5, nocturnal blood pressure dipping. In a healthy cardiovascular system, blood pressure naturally drops during sleep, typically 10 to 20% below daytime levels. Cardiologists call this nocturnal dipping. It's not incidental. It's one of your body's primary overnight repair mechanisms. Your arteries, kidneys, and heart all benefit from that nightly window of reduced pressure. People whose blood pressure doesn't dip at night, non-dippers, have significantly higher rates of heart attack, stroke, and kidney damage than those who dip consistently. The older you are, the more critical that distinction becomes. Sleep position influences whether nocturnal dipping happens. When circulation is compromised during sleep, when the inferior vena cava is partially compressed, when venous return is reduced, when your body's stress response stays partially activated because your cardiovascular system is working harder than it should, cortisol and adrenaline remain slightly elevated. And elevated stress hormones are a primary reason blood pressure fails to dip. Left side sleeping supports better venous return. It also reduces positional sleep apnea, episodes of airway obstruction that cause sudden overnight blood pressure surges, directly preventing nocturnal dipping. Fewer apnea events mean fewer pressure spikes. More consistent dipping means a heart that wakes up truly rested, rather than one that's been laboring against elevated pressure for 8 straight hours. I promised I'd return to Margaret. After our consultation, she made one change. She switched to sleeping on her left side. She placed a firm pillow behind her back to prevent rolling over and a second pillow between her knees to keep her spine aligned and her hips comfortable. 3 months later, she returned for a follow-up. Her morning blood pressure readings, the ones that had puzzled her cardiologist for 2 years, had dropped meaningfully. Not dramatically, but consistently. The elevation that had led to 2 medication adjustments had partially resolved on its own without any change to her prescription. The arm numbness she'd attributed to poor posture was completely gone. She was sleeping more deeply. Her husband said she was snoring less. She told me something I've thought about many times since. I spent 30 years as a nurse. I gave patients advice about diet, medications, and exercise. Not once did anyone ever tell me about this. That's the gap. It's not a gap in medical knowledge. The research exists, and the mechanisms are well understood. The gap is in the conversation between what the research shows and what actually gets shared with patients before they go home and go to bed. You're having that conversation now. Let me bring this all together. Here are 5 key takeaways to act on tonight. Your heart sits to the left of center. Left side sleeping lets gravity assist its pumping action for 8 hours every night, and that adds up. The inferior vena cava runs along the right side of your spine. Sleeping on your right side compresses it. Left side sleeping removes that compression entirely, supporting full venous return. Blood clots form in stagnant blood. Left side sleeping keeps circulation moving through the deep veins of your legs and pelvis. For adults over 60, this matters more than most realize. Your brain's glymphatic cleaning system works best when you sleep on your side. Clearing amyloid beta and tau protein overnight reduces vascular inflammation in the brain, and that directly lowers stroke risk over time. Left side sleeping supports nocturnal blood pressure dipping, fewer apnea events, lower overnight cortisol, and more consistent arterial repair. Now, how do you make the switch if you've slept on your right side or back your whole life. Start tonight with one firm pillow placed behind your back. It doesn't need to be large, just firm enough to prevent rolling over during deep sleep. Place a second pillow between your knees to keep your hips stacked, your spine neutral, and to eliminate any joint discomfort that might make side sleeping feel awkward. Give your body 1 week. The adjustment is shorter than most expect. After 2 weeks, most people stop thinking about it. Your body adapts quickly. You're simply guiding it toward a better pattern. Here's what I'm asking you to do tonight. Not next week, but tonight. Before you get into bed, place a pillow behind your back and one between your knees. That's it. The rest happens while you sleep. What position have you been sleeping in? And has any doctor ever discussed this with you? Tell me in the comments. I read every one. And if this video gave you something valuable, please share it with your spouse, a sibling, or a friend managing blood pressure or recovering from a cardiac event. This information shouldn't be hard to find. Let's make sure it reaches those who need it before they need it most. If you haven't subscribed yet, please do. Every week, I bring you honest, research-backed insights about what your body needs after 60. The kind of information I wish every patient had long before they ended up in front of me. Take care of your heart. It's been working for you every minute of every day for decades without asking for anything in return. Tonight, give it a little help. Turn to your left. Let it rest a little easier. Disclaimer: everything in this video is general medical information based on published research and clinical experience. It is not a substitute for personalized medical care. If you're managing a cardiac condition, sleep apnea, or have been advised by your doctor to sleep in a specific position, follow your doctor's guidance and discuss this information at your next appointment. Your situation is unique. This is education, not a prescription.